Colon cancer symptoms. Recognizing the signs. Colon and rectal cancers often lurk in the shadows during their early stages, silently growing and progressing without producing noticeable symptoms. As these tumors expand and evolve, the symptoms experienced by individuals will largely depend on the precise location of the primary tumor within the intestines. Patients grappling with colon or rectal cancer might eventually encounter one or multiple symptoms, serving as potential red flags for further investigation. These indicators encompass a wide range of issues, including gastrointestinal disturbances and systemic effects, all of which are crucial to understand in the context of early diagnosis and effective treatment. 1. Blood in the stool. One of the most recognizable and alarming signs of colon or rectal cancer is the presence of blood in the stool. This blood might manifest as either obvious, visible red streaks, or as a darker coloration of bowel movements, indicating potential bleeding within the intestinal tract or rectum. It's worth noting that bleeding can sometimes be hidden, known as occult blood, and may only become apparent through a blood test, revealing a reduced red blood cell count. Therefore, it is essential to pay attention to changes in the appearance of your stools. 2. Rectal bleeding. Bright red blood in the stool typically suggests bleeding originating in the rectum or colon, potentially signaling the presence of colon or rectal cancer. However, it's important to consider that rectal bleeding can also be associated with other conditions, such as hemorrhoids. Hemorrhoids often present with symptoms that come and go in flare-ups, whereas bleeding linked to cancer tends to persist or worsen, and may be accompanied by pain, emphasizing the need for medical evaluation. 3. Changes in bowel habits. Alterations in bowel habits can serve as a valuable indicator of colon or rectal cancer. These changes may include the sudden onset of constipation or diarrhea, fluctuations in the frequency, size, and caliber of bowel movements, a feeling of incomplete bowel emptying, the presence of unusually narrow stools, sometimes as thin as a pencil. While occasional changes in bowel habits can be attributed to factors like dietary adjustments, food intolerance, or viral and bacterial infections, persistent and unexplained changes lasting more than a few days warrant prompt medical attention. 4. Abdominal pain and bloating. Persistent stomach bloating, distension, cramps, or pain within the abdominal or bowel region could be indicative of colon or rectal cancer. It's important to recognize that these symptoms are not exclusive to cancer. They can also be associated with various other conditions, including diet-related gastrointestinal distress, Crohn's disease, or ulcerative colitis. If you experience chronic abdominal discomfort and bloating without an apparent cause, consulting a healthcare professional is advisable. 5. Nausea and vomiting. The presence of nausea and vomiting may arise when a colon or rectal tumor obstructs the normal passage of liquid or solid waste or gas through the bowels. This obstruction can also give rise to painful abdominal cramps, bloating, and constipation. Notably, nausea and vomiting can be indicative of numerous health conditions, both benign and severe. If you find yourself dealing with persistent nausea, signs of dehydration, or vomiting that persists beyond 24 hours, seeking immediate medical attention is paramount. 6. Anemia. Anemia, a condition characterized by a deficiency of red blood cells or hemoglobin, can develop in individuals with colon or rectal cancer due to intestinal bleeding. The location of this bleeding within the colon can result in anemia, becoming the initial sign of ongoing blood loss. Common symptoms of anemia encompass skin pallor, paleness, an elevated heart rate, fatigue, dizziness, and irregular menstruation. Recognizing these signs can be pivotal in identifying an underlying issue. 7. Unexplained weight loss, loss of appetite, and weakness. Unexplained weight loss, loss of appetite, and a general sense of weakness can all be potential manifestations of colon or rectal cancer, as well as several other unrelated conditions. In the context of these cancers, these symptoms are often interconnected. Persistent diarrhea, for example, can contribute to weight loss, while stomach pain and nausea might diminish one's appetite, resulting in inadequate food consumption and subsequent weight loss. Furthermore, these issues, coupled with anemia, can contribute to a sense of overall weakness, underscoring the importance of a thorough medical evaluation. 8. Pelvic pain. While not a common symptom, pelvic pain in patients with colon or rectal cancer may indicate that the disease has advanced or metastasized to the pelvic area. It is crucial to promptly address any unexplained or persistent pelvic pain and consult with a healthcare professional to determine its underlying cause. In summary, colon and rectal cancers often remain inconspicuous in their early stages, making it essential for individuals to be vigilant about recognizing potential symptoms. From gastrointestinal changes to systemic effects, understanding these warning signs can lead to earlier diagnosis and improved outcomes in the battle against these cancers. If you or someone you know experiences any of these symptoms, seeking medical evaluation and guidance is crucial to addressing and managing potential colorectal cancer.
Thank you for tuning in to Health Beat Now, where we empower you to live your best life. Remember, your health is your most valuable asset, and together, we'll unlock the secrets to optimal well-being. Stay tuned for our next episode, because at Health Beat Now, the pursuit of well-being never stops.